Welcome to the Cardio Ohio podcast, a production of the Ohio chapter of the American College of Cardiology. This is Kenny Graywall in Columbus, Ohio.
This is Ben Allencherry, Cardiovascular Imaging Fellow from Cleveland, Ohio. More information on the podcast, including past episodes, is available at ohioacc.org.
And now for today's episode. So welcome back, everyone, to the Cardio Ohio podcast. Thanks for joining us today. I'd first like to introduce my regular co-host, Dr. Ben Allencherry, who's back after a one podcast absence. Glad to have you back, Ben.
I feel refreshed from being on the bench, but I'm ready to get back in the game.
Excellent. Well, it's my delight to welcome a guest that I've known for many years, a fellow colleague of mine here in Columbus, and also somebody who I think is very well known to most of our listenership throughout Ohio, and that's Dr. Lakshmi Mehta. She is a preventive cardiologist here in Columbus at The Ohio State University. But as many of you know, she's worn many hats over the years. She was, of course, the president of our state chapter herself. Just recently, she's really contributed at the national level to American College of Cardiology in many ways on many different committees and initiatives. She has wide-ranging clinical interests in prevention and women's health. And we're going to hear more about her newest hat she's wearing for physician wellness. So Lakshmi, welcome to our podcast.
Thank you, Kenny. It's exciting to be here. And I really want to congratulate you and Ben for putting together this podcast series to bring your voices as well as leaders' voices across the state. So congratulations on that.
That's very nice of you to say. So thank you. So Lakshmi, obviously, I know you've had you have so many varied interests that you've contributed to in cardiac care and cardiac policy. Could you kind of summarize your path to your current position? And also, I'm just curious how you divide your time now as a clinician between some of the initiatives like women's health and lipids and prevention.
Yeah, my path has been never really planned. It just kind of fell into place, taking just different opportunities. But during my cardiology training, that's when the field of women's cardiovascular health started becoming a thing where there was an interest in it. And I had an interest during fellowship at Beaumont Hospital. So just started getting interested in that and got recruited to Ohio State to start the women's program. And when a field is in its infancy, you can really be part of the forefront and develop things as well as be a spokesperson. And so it just naturally fell into place. I would say now for our listeners, there are women's heart programs out there where you can get actual formal training in it. In addition, through the years, when you talk about women's heart health, a lot of the public campaigning surrounded prevention. And so prevention naturally fell into place. And so after being recruited to start the women's heart program and doing prevention things, I eventually went on to direct our cardio-preventative program along with the women's heart. And currently I'm the chief well-being leader for the Ohio State University Wexner Medical Center and the College of Medicine. And that's a new role that really doesn't have training. It kind of came to me after me doing research for the ACC on burnout and then leading the national ACC's efforts on well-being, burnout, where, what should the strategy be for the college? And then over the pandemic, this position came about of chief well-being leader. It's interesting because it's different than most places. Many people think of Stanford or Mayo, and they've really been physician-centric. And what we're trying to achieve is the entire medical health system. We can't function alone as physicians or APPs without our entire team feeling well. And so that's essential. And so I'm excited. It is a bit daunting to think of all 20,000+ employees to have an impact on their lives, but it's important. In terms of how do I balance it all was your question. I don't know. Being throughout my career as a cardiologist, I've never been a cardiologist without being a mother. And so as a mother and a cardiologist, you're always juggling things, and there's always some ball up in the air. You're trying to catch things and keep up with things. But different days, different things take priority. But in the whole grand scheme of things, everything's about prevention, whether it's prevention of for our patients, or it's prevention of mental health conditions or depression or burnout in our colleagues. That's important too.
Yeah, Lakshmi, that was an awesome answer. I guess just from a lot of our listeners are fellows in training or early career professionals. You kind of talked a little bit about how your early work in ACC led you to this area. But like now looking forward, what do you think were the skills you gained in your training and your early career that kind of that prepare you for this role and what changes are coming down the pipe?
That's a great question. I've never really thought of it that way. I
This
I guess
podcast will make you think hard.
I guess what I would say, and Canny can relate to it too, is we trained in an era that there were no work hour rules. There was no like restrictions on us. And you just worked to the core, and you worked hard, and there were times that you were stressed. Maybe burnout was a thing, but we didn't know it. Like it wasn't a word we'd ever accept, or it would feel kind of weak back in the day, right? So I think that, but when we reflect back at our careers and at the moments that we may have missed with our family, loved ones, especially as our kids go off to college, you kind of reflect of, gosh, what could have been different, right? What could we have done differently? What could have been better? And those are, those self-reflection kind of questions sort of help. But the skill sets is challenging, because I think like it's hard to be a leader in this field without some already leadership skills that you may have attained in different leadership roles or leadership experiences, because you're asking for cultural change, you're advocating for things that people don't necessarily believe in, and you're shifting people's concept from the patient to you as an individual. So that comes with experience, time, and effort. But there is no training program yet that exists on this field. There's on the job, there's passion, there's learning from each other that brings people to it. I mean, people often ask at ACC, like, what can they do? How can they come to this pathway? And I really don't have a specific answer. But I will say, in full transparency, when we first started looking at the burnout data at ACC, and it was brought to my attention, like, hey, we should add these burnout questions, because I wasn't even in my sphere of knowledge. Because, like I said, we thought we're all superheroes. When someone brought that up, I was like, gosh, why would we even test for burnout, right? It's just like, we're cardiologists. We don't burn out. Like that's not us. But as we got the data and I started researching it, like my eyes open, like, oh gosh, this maybe we've labeled it differently amongst ourselves, and it is a real entity. And so I think that the field is evolving. It does require a lot of us to open our eyes. And, I'm a true believer in that we can all burn out. We can burn out at different times. We can be highly stressed at different times. But it's a field that we still have so much to learn about. So I would say, like, gosh, for the fellows interested, the first step to take is maybe to be on a well-being committee and fellowship, or at your new job when you get there. And, think of things that you can do to improve well-being, and you can be innovative. It's like it's in its infancy, so you can paint it how you want it.
Yeah, I think that's a great point. And just from the fellow perspective, like you touched on this, the generations before us almost definitely had a harder time as far as duty hours, but we have a different sort of stress in life. I'd say they're all comparable.
Towards that end, Lakshmi, I do think the ACC had more foresight, I think, than some other medical organizations, because obviously this is a problem we're not going to solve overnight with easy solutions, but you can't solve a problem until you can measure it, quantify it, and at least acknowledge it exists. And I think the ACC has taken concrete steps towards that. And of course, one big step was the article you authored back in 2019 on physician burnout. And of course, this was almost in a different era now, pre-pandemic. I think that was the first time that we really could quantify that that burnout was real, that it was seen, I think, at over 25% of your respondents in that study. It was very common in mid-career physicians as well. I mean, we all are aware of the tremendous work stress associated with the pandemic on our professional life, on the care we had to give patients, the compromises we made, not to mention the threats to our own health. So, have you thought about how that survey might change now, as we're 3 years into a life changing pandemic, and how that might affect what you're going to do going forward in your new role?
Yeah, that's a great question. And, I would say, like with the pandemic, there's been a higher workload on people. They suddenly feel that. But as we mentioned, that high workload was there before. But what's the difference? I think the difference is we've we've kind of, medicine has industrialized. We're not working in independent practices. So we don't feel the same purpose that we used to feel years ago. And and so you don't have that same drive. And when you lack that purpose and greater cause, and then you're just held to numbers, that's where burnout occurs. And I think like early on in the pandemic, there was a lot of heroism in medicine, and we were considered heroes, like the whole medical team. And uh it gave it gave people a good feeling that you were making a difference, and there was a bigger purpose in what you were doing. But then it fizzled, right? And and slowly became almost villainous, right? Like that we were asking to do certain things like masks and vaccines. So it really impacted the mental health of our healthcare workforce and what to believe, what not to believe. Everyone stood on different perspectives. But our ACC data, we did collect data and presented it at the late breaking sessions for 2020 and 2021. And what we've shown is the burnout rates increased with the pandemic. And we also at this time even had CVT member burnout data, and the highest rise in or change in burnout with the pandemic, highest was among CVT members and then fellows. And that was concerning. And I think some of that's related to, the CVT members and fellows didn't really have control as much as attending cardiologists did, and couldn't control their schedules, just it, which when you don't have control, it can affect your well-being. So how does that translate to now, and how are we all coming out of this? It's going to be hard to say. I think like with the pandemic too, we know that people are a little bit more accepting of saying burnout. Beginning, I was saying that word didn't exist in cardiology. Now it does. And it does even more, and people can accept acknowledging that. So I think we're going to see potentially higher rates if we continue to survey people. But I also am very concerned about some post-traumatic stress disorder that may come about in the field of medicine. And we don't even have a grasp of what that's going to look like, or how long those effects are going to be, and who's that going to be. It's not just going to be the frontline workers, it's going to be everyone and its impact on them. From our trainees on board, the trainees were so affected with this. So I think locally, statewide, and nationally, we really need to make bold efforts into recognizing that, it's not just that the patient is the center of all that we do, but the employee and learner has a big part in that patient care and needs to be well too. And I think that's the one thing the pandemic allowed us, is to accept that we can burn out and normalize the word, at least burnout, in the news media and to the lay public.
Ben, I'm just curious, you obviously started your training quite a few years ago, pre-pandemic in medicine, and you went through a cardiology fellowship, and now you're a sub fellow. You're almost a professional trainee in a way, right?
I love it.
Yeah. But seriously, what do you hear from your colleagues and the residents you work with about one of the biggest things they feel? Because I can relate how clinicians feel. I talk to them every day attending some practice, but I'm curious about your trainees, and compared to say 4 or 5 years ago, what are you hearing from them now about the sources of daily stress?
Any great question. Before I answer, two things. We tend to call it super fellow, like a superhero, instead of
Oh,
sub fellow. And I'm pretty sure my wife will leave me if I get to PGY 10. But so I will answer this question. I trained for about 4 years before the pandemic. And then I'm just looking now. And I think like the real big thing is what Lakshmi had said is I just feel like now people are talking about things more. So I was a chief fellow at Cleveland Clinic and really intimately involved with a lot of the fellows in terms of their like stressors in life. And, if someone has to call off work, some of the openness that I was hearing was definitely different pre-pandemic. And I think it's a positive externality of a horrible situation is that people became more comfortable discussing this.
Yeah, that's good to know. That's very good to know because that certainly wasn't the case in the past, as Lakshmi alluded to. My observation about trainees has been, just like Lakshmi was saying, 20 or 20 plus years in my case ago, when we were in training, of course, we didn't have the work hour restrictions and so forth. Obviously, it's gratifying that those restrictions are in place. But, when I talk to trainees, including my son, who's a second year internal medicine resident in Chicago, I feel like you have cut those restrictions have kind of traded one set of stressors for another. I mean, you're not working 36-hour shifts, but you're doing a lot of night float, a lot of ad hoc shifts on the fly, jumping between night float and daytime. And there's a lot of literature just about how that can adversely affect your physical health and mental health.
Yeah, I definitely agree. And like you said, there's even just something about, the shift work disorder, about sleep irregularities, but also, you're jumping into patient coverage. So these are all things that have come up with this kind of shift work mentality. I guess I'll pass it over to Lakshmi and just ask, I know that you're early in your work as being involved with Chief Wellbeing Liaison at Ohio State, and I don't want you to spill any sort of programs that are still in development, but I kind of just want to know, from someone who has now spent dedicated time thinking about this, what steps do you think training programs can do to kind of address this? And this is focused on fellows, I guess I'll say.
That's a really good question. And I would say though, like besides the sleep issues for you fellows compared to Canny's and my time is the sheer amount of data that is coming at your guys' way. I mean, science keeps changing like second to second, it feels like, in the amount of journals and things and how it's that pressure of keeping up that's problematic. So for training programs, there's actually an ACC program director's data on burnout as well that came out a couple of years ago. And that showed that it was your own program directors are struggling with burnout. And very similar to our data amongst all cardiologists, that higher rates were in the mid-career program directors as well as female program directors. So top down, bottom up, everybody's got to be cared for. Big thing is this changing the culture, right? If we can't fix the culture, we can't fix anything else. And so, tackling what a culture of well-being would look like. Some of the simple things is that people taking all your vacation and not feeling pressured that if you miss a day for vacation or a week for vacation, you're going to be behind. That concept we have to remove for our trainees and ourselves as attendings. Having, setting boundaries on what our workday looks like, because we can make your workday long as a fellow or super fellow, right? But setting boundaries of like what those hours are, like even though it's still in the work hour rules, but like, hey, I can make you stay till 7 p.m. to read all my echoes. Well, that's not appropriate either. So learning how we can set appropriate boundaries, time boundaries for our fellows, and giving that culture of you need a life outside of cardiology as well is essential. For us to bring our full self here, we also have to have a life outside where we feel supported as well. And so culture in those regards, limiting email time is important as well. So not having to respond to emails after hours, not sending emails after hours as much as we can, and that sleep culture is also going to be important, acknowledging that we all need sleep and we don't need to be a super fellow anymore. But one other very important aspect of the culture that has to change within training programs, but in cardiology itself, an area I'm passionate about as well, is the hostile work environment in cardiology. So we've written data also on the existence of discrimination and harassment in cardiology. And we will not be a field that is well until all feel included and belonging in the field. And so we have to make it psychologically safe and physically safe for everyone in the team. And so, as fellows, advocating for diversity, equity, inclusion is going to be important. Your fellowship programs should also have venue where people can discuss or bring forth their complaints, and if necessary, even having an ombudsman person. In training, other important aspect is mental health. Mental health is important. So destigmatizing the need for mental health care is going to be important amongst our trainees. And then figuring out what are the systemic issues that the trainee needs to do versus not do, right? Like is there and it's a new thing that I heard about is an academic culture versus a learning culture. And really we want our culture and our programs to be learning. So is this a benefit for the trainee, and are they learning from this experience or whatnot? Or is it just one more thing to put on, like they read 100 echoes, but if they didn't really learn anything, then what's the point of it, right? So trying to make it, and also the point of not being punitive. Like in a learning culture, you're allowing people to learn and not be punitive or demoralizing to them if they don't know the answers or they make mistakes. And that's a shift that we need to make as well. So those are a few things that anyone could kind of consider in their local programs.
Yeah, Lakshmi, you brought up education, which is particular interest of both mine and Kenny's. Is like in residency and fellowship, I was very lucky. Two stellar program directors who really valued noon conference, and not even just it's not like a thing where people get pimped. It's really just like a time where you value and prioritize learning, and I think when you do this in a sort of approach where you explain to like the echo lab and the nursing staff that, hey, all the trainees are expected to be at noon conference from 12 to 1. Please hold any sort of non-emergent pages. I think when you start to put value on things like that, that means more than any sort of like statements. And when trainees, I think, feel that hey, the institution values not only my education time, but also it's a time for community. I think that can like reinvigorate trainees who, we often work 6 days in a row. It's like things like that, where it's kind of to what you're saying, that when the institution shows that they want to put value on certain things, it means much more.
Absolutely. And so as a trainee, it's the fact of you not having to ask, hey, can I go to noon conference? But the culture is, hey, the noon conference is in 10 minutes, get out of here, right? So that's the kind of thing that we need to, as attendings, kind of instill is that coming up, you need to go. I can finish the rest of this myself, take off and advocate for that. I think also when there's food, we can attract the fellows more easily too, because, part of that social connectiveness and breakdown of barriers is actually when there's food involved. Food also brings people together and connectiveness, and there's research on that too.
Well, Lakshmi, I think there's so many other areas we could get to, but just in our last couple minutes, one thing I did want to touch on before we finish up is, I know the ACC did put out a very nice statement in the fall about career flexibility for healthcare and CV professionals. I really thought it was a nice statement that emphasized, work hours, time away for new parents, etc. Are you planning to incorporate some of those things into your role at OSU, or do you think at OSU they've already started to accept some more flexibility for cardiologists? Because I really think for people like me who are mid/late career, that kind of flexibility may be a way to keep cardiologists productive and working when they might otherwise think about retiring.
And that's excellent. And that's an excellent point because, cardiology is an older field, meaning we're heavier at the later the 45 and above age bracket than the younger bracket. So, if suddenly everyone starts retiring, we're going to really struggle and affect the burnout. So I feel bad for super fellow Ben there. But yes, at Ohio State, we have done full careers for some time. So we've had cardiologists that work part-time, and we've even had some late career cardiologists or even mid-career who kind of chose like, hey, I just want to work outpatient and things like that. Flexibility is great, but we also need to recognize that there is higher workload on those who are working full time and take call. So there's going to have to be frank discussions of what does salary look like, what does call look like, what does it, and also who's going to like manage your in basket when it's your day off. Like, what are those work expectations? And you want, if you're going to have a flexible career, you want to make sure you're doing it the right way and not regret it, right? So like if you're working 3 days on paper, but you're really working 5 days, and it ain't so flexible, because flexibility doesn't mean that you have to, on the 2 days off, you're still attached to the computer, right? So really thinking it through. But I really applaud the ACC for, creating that document and normalizing the conversation of a flexible career. And we need to recognize that happens not only at the tail end or when people have children, but throughout our careers. You may have unfortunately a colleague or yourself who has a medical illness that needs to take time off. And how do you handle that, and how to approach that and be supportive of your colleague or yourself and still make your practice thrive are real challenges. So there's a lot in that document, and I would suggest people to read it. But as I also said, is to suggest, like, if you're thinking of a flexible career, is talk to others who are doing it or who have experience or who lead efforts like that to figure out what's the right mix for you.
Well, that's wonderful, Lakshmi. I think we unfortunately do need to wrap up the conversation. There's so many other areas I think we could touch on. So I do hope we can have you back in the future as you grow into your role at OSU and maybe enlighten us a little bit more with your experience there as time goes on, because this is obviously a conversation that's going to be continuous. I want to remind our listeners that we are going to put links to a few of these documents in our notes, including the wellness policy, but also the survey on mental health conditions that Lakshmi co-authored just a few months ago. So there'll be plenty of resources, as well as a resource from the Ohio State Medical Association, which has a portal for physician well-being for clinicians here in Ohio. So thank you, Ben, and thank you, Lakshmi, for your insight. And we look forward to your future input as well.
Thank you very much for having me.
Thank you for joining today's podcast. For more information about the speakers or the topics, please go to ohioacc.org.